Hello and welcome to Medical Dialogues. I am Dr. Bhumika. Let's look at today's top medical news. Can long-term air pollution exposure increase risk of depression? A study published in Environmental Science and Ecotechnology has revealed a strong connection between long-term air pollution exposure and an increased risk of depression. The research led by Harbin Medical University and Cranfield University analyzed data from over 12,000 participants in the China Health and Retirement Longitudinal Study. The study identifies sulfur dioxide as the most significant contributor to the depression risk, with fine particulate matter and carbon monoxide also linked to depressive symptoms. These pollutants were found to have a compounded impact when combined, highlighting the dangers of multi-pollutant exposure. The research also explored potential mechanisms, findings that cognitive and physical impairment partially mediate the link between pollution and depression. The findings emphasize the mental health risk posed by environmental pollutants and call for urgent action to reduce their levels. Empathy-focused phone calls may control diabetes in low-income adults. Empathy-focused phone calls made by trained non-medical community members led to significant improvements in blood sugar control for low-income adults with diabetes, according to a new study from Dell Medical School at the University of Texas at Austin in collaboration with Lone Star Circle of Care. The study was published in JAMA Network Open. The research suggests this approach could provide a simple, cost-effective model for managing chronic conditions, particularly for patients with limited access to traditional mental health and support services. During the 6-month clinical trial, 260 patients with uncontrolled diabetes were randomly split into two groups, one receiving only standard care and the other receiving both standard care and regular calls focused on listening and empathy. These calls were made by community members trained to provide compassionate support, enabling participants to share their experiences and challenges in living with diabetes. This approach begins by acknowledging the real-time and everyday challenges of living with diabetes, said Maninder Mini Kalon, PhD, lead author of the study and associate professor in the Department of Population Health at DelMed. By offering genuine, empathetic support, we had an impact on health that's the clinical equivalent to taking medicine. That's because emotional well-being is the gateway to the lifestyle changes that improve management of the condition, an area where traditional healthcare often falls short. Updated Hep B vaccine may improve antibody response in people with HIV. A newer vaccine against hepatitis B virus was clearly superior to an older vaccine type in inducing a protective antibody response among people living with HIV who didn't respond to prior vaccination, according to the results of an international study led by a Weill Cornell medicine investigator. The study reported in JAMA showed that hepatitis B vaccine with a cytosine phosphoguanine adjuvant known as Hep B CpG induced protective levels of antibodies in up to 99.4% of the subjects who received it. Such protection was seen in only 80.6% of subjects who received hepatitis B vaccine with an aluminium hydroxide adjuvant known as Hep B alum. The NIH-sponsored BEE-HIV-E, that is B enhancement of HBV vaccination in persons living with HIV trial, is a phase 3 study with 561 participants at 40 sites across North and South America, Africa and Asia. The participants are people with HIV who reported prior vaccination against hepatitis B but lacked protective levels of antibodies. Prepare meals to reduce calorie intake at home, study finds. A new analysis led by researchers at the Johns Hopkins Bloomberg School of Public Health found that more than half of calories consumed at home by adults in the US come from ultra-processed foods. The study was published in the Journal of Nutrition. The perception can be that junk food and ultra-processed foods are equivalent, says Julia Wolfson, PhD, MPP, Associate Professor in the Bloomberg School's Department of International Health and the study's lead author. Yet, ultra-processed foods encompass many more products than just junk food or fast food, including most of the foods in the grocery store. The proliferation and ubiquity of ultra-processed foods on grocery store shelves is changing what we are eating when we make meals at home. For their analysis, the researchers used data from 2003 to 2018 National Health and Nutrition Examination Survey. On 2 separate days, participants were asked about the foods they had eaten in the past 24 hours and where they had consumed the foods at home or away from home. Using the NOVA food group classification, a well-established framework for grouping foods by level of processing foods were assigned to one of the 4 categories. 1. Unprocessed or minimally processed food. Number 2. Processed culinary ingredient. Number 3. Processed. And number 4. Ultra-processed. Thank you for watching Medical Dialogue. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.